Hello, Sarah here from the Centre for Mental Health. I hope all is well. Happy New Year. 2019 has finally arrived, and I think it's going to be another big year for mental health. And we started with a bang. The NHS long-term plan launched on Monday, and it was great to see that mental health was centre stage, really, of some of the most important announcements that were made. I think that it's really important to acknowledge that the mental health team that worked in developing the proposals for the long-term plan over the summer and autumn worked tirelessly to really convey to the kind of decision makers how important it was not only to invest in mental health, but to really think about what was important over the coming decade, to really understand the things that we need to not just expand, but do better. So I kind of want to say thank you to the NHS mental health team, Claire Murdoch and colleagues. I know that certainly the competition for funding is, really tricky, and we really appreciate all of the work that you did in terms of making the business case as clear as it was. So £2.3 billion investment, ring-fenced, really important. And I think the things that have been identified in terms of what the priorities need to be are the things that we would probably agree with the most. So, of course, investment into children and young people, expanding the age to 25, will absolutely deal with some of the difficult issues that children and young people experience now about transitions, about accessing help quickly enough. The expansion, the scale up is obviously important, but we are keen to think about what those services might also look like. So scale is important, but let's think about the detail, and let's think about reimagining children and young people services so that they are accessible. And the investment here gives us a real opportunity to do that. We are also really pleased to see the investment into crisis services. For so long, people have really struggled to get help at the right time. And I think that whilst there has been a huge amount of work over the last 4 years around crisis development, that isn't shared across the UK in quite the same way as it should be. We also know that some people from Black and minority ethnic groups and others find it really difficult to access the right crisis support. So this funding and this pledge gives us another opportunity to really think about what crisis services work best. How do they attend to the needs of all people? So we welcome that pledge and look forward to the detail of that. We also welcome the pledge to enhance and scale community mental health services. Again, for a long time, we have taken our eye away from community mental health services and looked elsewhere in terms of developing mental health, primary care services and others. But we mustn't forget that community mental health services, whilst their capacity has decreased, the demand has increased. So we look forward to really thinking about what the scale is going to look like and what does it mean in terms of the configuration of these community mental health teams. So we would like to work alongside colleagues to think that through. We're delighted, of course, at the Centre for Mental Health about the continued expansion of individual placement support, helping people get into employment, to stay in employment, and for their wellbeing needs to be met. We absolutely are clear that we believe people have the right to work and can work if they have the right skills and support in place, and we think IPS gives the best chance of achieving that. There are so many other things in the long-term plan that sort of are mentioned in terms of what's going to happen next. So things like primary care, thinking about how can we expand and develop primary care so it meets the needs of people who we at the centre call people who fall into the missing step in between primary and secondary care, who often have complex needs but find it really difficult to access services for all sorts of reasons, thresholds, availability, all sorts of different reasons. I think the things that we want to see more of are really about the detail. And of course, this plan couldn't go into the detail that we all needed. One of the big things, of course, is workforce. How are we going to find the people who are going to deliver these services? What type of people do we need? So we're really keen to see the detail, and we know that that's going to be coming at some point. We know that there's work being done around peer support, and we really want to know that those roles are included in thinking about how we're going to achieve some of these ambitious pledges. We also want to know about the role of the third sector. Much of what happens on the ground in communities is delivered by third sector organisations, grassroots communities who are there every day when people need it. And so we really want to know how the NHS are going to kind of work in synergy with organisations who are doing all sorts of extraordinary creative work on the ground. So we like to know more about that. We want to know a bit more about this primary care pledge. We really want to know how it will particularly address the issue of inequality. And I think from our point of view, the missing step, the numbers of people in this missing step gets bigger every day. And we want to see a real concerted effort into understanding how the needs of that group can be met. And I think we would also say that whilst this plan doesn't necessarily reimagine mental health services or the landscape for mental health going forward, that really is the thing that we need to do. What is the vision for the mental health of the population across the UK? What does prevention really look like? And I think there's some real ambivalence and confusion about the role of public health and NHS in terms of prevention. We really want prevention at the heart of all plans going forward, and I think we have been sidetracked about the funding formulas for all of that, but we certainly know Public Health England and the NHS are committed to try and work this through, and we would like to see more of that. I guess our final plea, and we're always going to say this, and I find myself sounding a bit like a stuck record, that the NHS are not the only organisation responsible for the mental health of the nation. There are many other organisations involved, many other organisations that we need to think about. What we'd like to see is a cross-government approach to mental health. Housing, poverty, all of the things, education, all the things that we keep mentioning over and over again. Also our colleagues do from other organisations. We're all saying the same thing, that people are not just their clinical needs. They have their whole lives that sometimes needs help when they're vulnerable. And I guess my massive concern, and I think this is the thing that probably will keep us all awake at night, is that our NHS will fail if all of the other aspects of people's lives are not attended to. If we have a robust welfare system, that would make a massive change. You can provide all the mental health interventions you like for an individual, but if they're still going home to a very poor accommodation situation, or they're facing real difficulties in terms of money, then that intervention is going to be sabotaged. And I guess we can't say that often enough. The NHS is critically important, and absolutely we mustn't take away from how very important it is in terms of making people feel like they have a chance of getting better. But it's not the only organisation, and we can't pretend that it is. So we, on one hand, welcome this this pledge, this set of promises to us and to communities about making things better. And I believe it to be true. I mean, I absolutely believe that the commitment in the NHS is there, and it's stronger than it ever was. But the NHS also need their partners to help. So we urge the government again to take that approach, look at the kind of cross-government thinking about how could we really make a change? What would the vision of mental health in the UK look like if we did that? So I kind of leave you with that thought, and you know, obviously we've had lots of commentary across social media about the long-term plan over the last week. We're really keen to hear from you, and do let us know. We have made a number of other announcements over the last week, so do check out our social media accounts. We're really delighted to have announced our Writer in Residence programme, and Mark Brown. Oh yeah, we're really excited about kind of launching his first piece as part of that programme. And yeah, so we're around as always, and we'll speak to you next week. Take care. Bye.